Belize has a number of social protection programs that are doing excellent work. They are spending a fair amount of money on the programs based on the social protection policy note that was published in 2010. Programs they're pretty well targeted to the poorest populations, but there are gaps in terms of coverage. There are important populations that are not being covered right now. I think we mentioned a number of the populations in the south of Belize or in the north that have been identified as the poorest. And so there's been a promotion by the World Bank through technical assistance to ensure that the programs are better targeted. In terms of systems, Belize is one of the few countries right now in Latin America that's actually trying to look at the number of programs they have and actually saying, how do we rationalize the spending, as CEO Alpuche mentioned earlier, and make better efficient use of this spending to create a more systematic approach to implementing these programs. In systematic, I mean when rather than having individual programs focusing on different parts of the population, actually saying, okay, for children 0 to 5, we're going to have this comprehensive package of programs, well coordinated across ministries to ensure that these children reach the age of 5, they're not malnourished, they're well developed, and they're able to then move from the age of 5 into primary school and actively participate. The World Bank is not making any technical recommendations on programs to be eliminated. Our recommendations are simply to take a closer look at what programs Belize already has in place and to better organize them. I think someone mentioned one of the biggest obstacles to effectively implementing policy is there's a lot of turf wars. This is my money, this is my budget, this is my program, and really taking a step back and saying, okay, we're all focusing on the same population here. How do we better organize the programs that already exist, create efficiencies in terms of human resources, rather than having 3 or 4 different people visit the same household, only having one, and then having activated referral systems so that if someone goes to the household and they say, okay, I'm here because I'm here to provide the immunization for this child, but really, in fact, this child is not attending school, that should automatically activate a referral system to the Ministry of Education so that there's this constant conversation in between programs, in between ministries, to really achieve a common set of outcomes. So again, the World Bank is not really providing technical assistance on what should and should not be cut, but more how to effectively look at what Belize has and create a stronger coordination between those programs.